Good morning, everyone. Good morning. Come on in. We are on YouTube, live on YouTube. All right. I feel like I have a little bit of an echo.
Live on YouTube.
All right. Give me one second.
I have a little bit of an echo.
Fixed it. All right. Hi, everyone. Welcome. My name is Dr. Sarah Ellis. We're waiting for some folks to trickle in. So, how about we hop in the chat? Let me know where you're joining from, and maybe share how you know me. How did you find out about this webinar this morning? Hi, Mary. It's so good to see you. Wonderful. I'm going to give it just a couple more moments for folks to join in. I have to clean my glasses. All right. Hi, Yolanda. Welcome. All right. We have a couple more folks in there, so I'm going to start posting my slides, and let me know if you can see them. There we are. I feel like I had a couple questions for you guys in the chat, but they're all gone now. I'm sure they'll come back. Any plans for this beautiful Saturday? It's kind of rainy here in Charleston. All right. Hi, Sarah. I'm so glad you found it on Eventbrite. I hope you learn a lot. These slides are going to be available. If you found it on Eventbrite, then I already have your email address. I'll send it out to you. If you are joining me from YouTube, I'll have the link to the slides where you can get the slides in the description box. Awesome. I have to go on Instagram and let folks know that the slides are available, and it's completely free. This is a labor of love. It's something that I've been wanting to start doing for quite some time, and I'm excited to finally just be able to teach because I want to. So I'm excited for today. All right. Welcome. My name is Dr. Sarah Ellis. I am a naturopathic physician, and I am a clinical educator. And I wanted to host my very first masterclass because even though I'm a naturopathic physician and trained to care for patients, my true love and my passion comes from teaching. And as an ND, that's what we call naturopathic doctors, ND. I can't tell you how many people would come into my office and I talk to them about things and how their body works and different facts about different conditions, and so many of them would say, oh my god, I never knew this, no one ever told me this. So now it's time for me to really give back and start teaching, and these master classes, I'm going to try to do them monthly. They'll always be free, and they're designed to really just provide you with information so that you can go to your doctor's appointments and to your PCP or primary care physician feeling prepared, feeling like you have an understanding, a general understanding of your condition and your options as well, and kind of learning different questions to ask and red flags to look for, particularly when it comes to labs. So I'm going to start with meeting me, introducing me. I know some of you may know me already, but for those of you who do not, my name is Dr. Sarah Ellis. I'm a naturopathic doctor, I'm a wife and a mom. I have over, it's 2023, so I have about 11 years of experience as a natural products researcher. That's actually how I got into naturopathic medicine. And my full-time job is as a clinical educator for a international biotech company. I am providing health and wellness education through my virtual platform, Ellis Family Wellness. And when I'm not speaking and teaching across the country, you can find me at home with my two little nuggets here. This is my daughter, Egypt. She's 2 years old and a Spitfire. And this is my son, Roman, who is so sweet and funny. And this is my awesome husband, Chris. And so typically I'm hanging out with them and running around and doing all the fun mommy stuff. But I'm excited to be in front of you today to share my knowledge. Um, like I said, all of these teachings are free. I do welcome donations through Venmo at S Green Ellis. That's my Venmo. If you find it in your heart to donate, but know that it's not required. All right, so today we are going to be covering quite a bit of information. I am going to keep it as simple as possible. I don't want to overwhelm you, but it's going to be kind of fun. So, we are going to go over holistic health basics. I'm going to share some fascinating facts about the human heart. We're actually going to play a little game. I want to share some stats about cardiovascular disease in the US, and particularly the different types of cardiovascular disease, because there's quite a few. Then we'll go over some labs. So essentially, I'm going to kind of walk you through the normal ranges of different labs. And then I'll give you a list of labs that generally your primary care doctor is going to run regularly and things you should kind of maybe request. And some of them will be specialty tests that not all MDs will be interested in running. Some of them your insurance company may not cover. You may have to pay out of pocket, but I at least wanted you to have that information. We will also then get into the good stuff, right? So foods for a healthy heart, nutrients for a healthy heart, herbs for a healthy heart. And then, of course, at the end, I'll talk about ways to get in touch with me, connect with me, and stay up to date with my masterclasses. So, of course, I have to put a disclaimer because this information is for educational purposes only. This is not to be considered medical advice. I am not operating as your medical provider. And of course, whenever you are interested in making any changes to your health regimen, please consult your doctor first. Okay, let's play a game. It's called Two Truths and a Lie. So, we're going to start with the first question. Typically, how these go is that I want you to identify two truthful statements and the one lie. So, in the comment section, they were supposed to be numbered, but they're bulleted. So, just put like the number of the bullet that you think is the lie. So, first question, the first set of statements. Number 1, high blood pressure is considered to be the silent killer. Is that a truth or a lie? Your heart is the last organ that's formed during pregnancy. Is that a truth or a lie? And then the third one, a blood pressure reading of 125/86 is considered pre-hypertension. So out of those three, which one do you guys think is the lie? I should have had some Jeopardy music going on in the background. But hop in the chat. Tell me which ones do you think. For this first one right here, if you can see my cursor, which one of these three is a lie? All right, we got threes. Some folks think it's a 3. Some thinks it's a 2. Yes. So 2 is the lie. Yes, your heart is nearly fully formed by the 10th week of pregnancy, actually. It's one of the first organs to be created during gestation. So yes, high blood pressure is considered to be a silent killer. I think we all kind of have heard that over time. And actually, yes, a blood pressure reading of 125/86 is now considered pre-hypertension. Right now, normal blood pressure is considered less than 120 and less than 180. So they have kind of switched up the requirements on us recently. And we'll talk a little bit about that in a little while. All right, another one. Let's find the lie. 1 in 5 Americans have high blood pressure. Heart attacks can feel different in women versus men. And uncontrolled hypertension or high blood pressure can damage your kidneys and eyes. So, out of those three, which one of these is the lie? Let's see. I really should have had some Jeopardy music. I'm going to have to prepare this for next time. All right. So the lie for this one is number one, the first one. 1 in 3 Americans have high blood pressure, not 1 in 5. And yes, heart attacks can feel very different from men and women. We'll talk a little bit about that. And yes, uncontrolled, poorly controlled blood pressure can damage your kidneys and eyes. Anyone who has high blood pressure should be seeing an ophthalmologist once a year. And also, your primary care doctor will be monitoring your kidneys with labs. And last one, let's find the lie. A diet low in potassium and high in sodium is associated with high blood pressure. That's the first one. Second one, white coat hypertension is a myth. And the third, the longer you have high blood pressure, the harder it can be to correct it. Which one of these is the lie? Let's think. Yeah. All right. Number two. Number two is the lie. White coat hypertension is actually true. It's not a myth. It's a real phenomenon that happens in many people. A primary root cause of blood pressure is an imbalance between potassium and sodium. Really, we should have a bit more potassium than we have sodium, but we live in America and we eat so many processed foods that we are eating significantly more sodium than we should be. So thank you for playing. I hope you learned a lot about the heart and we've broken the ice a bit. So let's get started. I hope you have a notepad and you're able to take some notes. All right, so statistics. I wanted to show this map just to show how widespread cardiovascular disease is. It's actually the number one killer for Americans, and it really disproportionately affects the Black community. Great question, Shauna. What is white coat hypertension? White coat hypertension is when your blood pressure is normal whenever you check it at home, but every time you go to the doctor, your blood pressure is elevated. And researchers believe that that's because, we put a lot of pressure about having a good blood pressure reading when we're in the doctor, right? Because the last thing we want is either being diagnosed with hypertension or needing to increase our medication. And sometimes, especially in the Black community, we may not be fortunate enough to have a really healthy relationship with our healthcare provider. And so if you already have kind of a mistrust or distrustful relationship with your healthcare provider, that can cause more stress and cause your blood pressure to increase. So that's what white coat hypertension is. I'm glad you asked that. And again, feel free to ask whatever questions as we go along, and I'll see them in the chat. So yes, cardiovascular disease is the number one cause of death in America. It disproportionately affects communities of color, specifically Black Americans. As you can see on this map, a great majority is kind of concentrated in my neck of the woods, in the South and a little bit of the Midwest. Some areas, they don't have as much high blood pressure, but it is pretty pervasive throughout our country. And that really can be attributed to so many things between diet and stress levels and water quality. All these things can play a role. Every 40 seconds, someone has a heart attack. That's really insane to think about, but it's true. Every 40 seconds, someone is having a heart attack. And even worse, every 3.5 minutes, someone dies of a stroke. I wanted to put these stats up because um, for some, it's just blood pressure, it's fine. I'll just drink some water. I'll figure it out. But it really impacts your entire body and is making your heart work so hard that it's not going to be able to really last very long. Our heart is a muscle that's pumping from the really probably the 20th week of pregnancy. So your heart is pumping fluid from the womb up until ideally your 70s or 80s. And so we want to keep our heart healthy and working well. So let's start with the types of CVD. CVD stands for cardiovascular disease. We want to start with the overall big umbrella term, which is coronary artery disease. Now, this is the most common form of heart disease, and it's really kind of a umbrella term that incorporates a lot of different things with regard to heart disease. So, the major blood vessels that supply the heart, these are coronary arteries, little arteries that are actually on the surface of your heart, and they give blood to our heart. So when they struggle to send enough blood directly into our heart muscle is missing out on blood, nutrients, and most importantly, oxygen. Now, this can happen when cholesterol kind of deposits and creates plaques in our arteries. And as these plaques begin to develop, they make our blood vessels that kind of go from here and they narrow them down. So less and less blood can make it through and get to the heart. It can also cause inflammation, and generally, plaque is the primary cause of coronary artery disease. But we always have to think about what is causing the plaque, right? So that's my philosophy, really, in general, is root cause medicine. So the signs and symptoms of coronary artery disease typically happen when that heart doesn't get enough oxygen rich blood. So when those little coronary arteries sitting on the surface of your heart, when they're narrowed and narrowed and narrowed, then you get less and less oxygen. And what happens when that happens? You start to have chest pain and shortness of breath because your heart is literally kind of suffocating while it's still trying to pump blood throughout our body, right? So, chest pain that's associated with poor blood flow to our heart can feel like a lot of these. Of course, we're familiar with folks who say, oh, it felt like an elephant. Oh, sorry. I should have muted my phone. They'll say, it feels like an elephant is sitting on my chest. Oh my goodness. Or the pain is located right in the middle of my chest. That's what some folks may say. You may also feel a burning sensation. It could even feel like a choking feeling in your throat or like a toothache. Or for women, it could feel like your bra is just too tight. You feel constricted. There's so many different ways that chest pain associated with poor blood flow to the heart can feel. And I wanted to put this here because so many of us think of the elephant sitting on the chest, but a lot of us don't have that. A lot of people, this chest pain can present a lot like these that I've mentioned here. The next type of cardiovascular disease we will be talking about is high blood pressure, also known as hypertension. Now, as you remember in the very beginning when we did two truths and a lie, the blood pressure reading of, I think it was 128 over 86, that is now considered um, elevated or pre-hypertensive. So, of course, we're used to saying, oh, my blood pressure is 120 over 80. I'm great. Now, what the American Heart Association has decided is that the ideal normal blood pressure is less than 120, less than 80. If your blood pressure then begins to be in between 120 and 129, and the blood pressure, the diastolic or the bottom number with the blood pressure is less than 80 or maybe between 80 and 89, then you're in the pre-hypertension stage. And then, of course, there's stage 1, where the upper number or systolic number is between 130 and 139, and that bottom number is between 80 and 89. Then high blood pressure stage 2. This is when that upper number, the systolic number, is 140 or higher. That bottom number or diastolic number is going to be 90 or higher. Now, this is the area I want us all to pay attention to and try to remember. A hypertensive crisis is an emergency. If you take your blood pressure and it is higher than 180, the upper number, and the lower number is higher than 120, you should call your doctor immediately and let them know. This is time where you need to go to the doctor to get some additional medication to help lower your blood pressure so that you don't run the risk of having a stroke. Now, over 60 million Americans have high blood pressure. In fact, more than half of all Americans, and these are older Americans, 65 to 74, and almost 3/4 of Black Americans between 65 and 74 have high blood pressure. 71% of Black Americans between 65 and 74 have high blood pressure. So it's very important for us to monitor this and learn some ways to help modify and reduce your blood pressure. Now, the truth is, over 80% of patients with high blood pressure are actually in the pre-hypertension stage 1 hypertension range, right? Now, that's good. That's a good thing because at this level, these blood pressure numbers can actually be brought under control with changes in diet and changes in lifestyle. Now, lifestyle factors that are associated with high blood pressure is having a lot of coffee. Now, listen, I'm sitting here with my Starbucks flat white, right? Anyone who knows me knows I have to have my coffee, ideally at Starbucks. I'll do a little Javalia at home with my Keurig if I have to. But having multiple cups of coffee every day really does impact your high blood pressure or your blood pressure in general because of caffeine, right? Other factors include alcohol intake, excessive alcohol, lack of exercise, being sedentary, of course, stress, but I mean, we live in America and we live in now in this age. So stress is everywhere, right? And of course, smoking. Now, dietary factors, we have to be very careful about obesity. Again, we want to monitor our sodium and potassium ratio. So, if any of you have a diet app like MyFitnessPal or something like that, if you put your foods in, it will show you not only your macronutrients, but your micronutrients like potassium and sodium. And so that's a way for you to see how much sodium you have and how much potassium you have. And another question, awesome. Does multiple cups of black tea have the same effect as multiple cups of coffee? Great question. Black tea does not have nearly as much caffeine as coffee. So if we're comparing coffee with some of the teas, coffee has the highest amount of caffeine. Then you have green tea, which is right behind it. Then you have black tea, and then you have like white teas. So multiple cups of black tea per day can be fine. I would be careful of that if you have thyroid disease. Sometimes the chemicals in the leaves called tannins, they can potentially interfere with like thyroid medications and stuff like that. But that's at excess amounts. But I would pick black tea over coffee if we were concerned about caffeine levels. So yes, we want to monitor our sodium to potassium. Typically, folks who have high blood pressure, they have low fiber diets, high sugar diets. diets that are high in saturated fats, low in essential fatty acids like fish oil or eating fatty fish. And then also, generally, the diet is also low in calcium, magnesium, and vitamin C. So we'll talk a little bit more about diet and nutrients once we go down a little bit. And I'm sorry, this is so light. It's hard to see it. I'm going to make sure I bold that for you before I send you the slides. But now we're going to talk about high cholesterol or hyperlipidemia. So this looks at how much fat is in your circulation. And when that fat or cholesterol really builds up into our circulation, it can be kind of sticky and stick to walls. But I also want to highlight that hypertension can also exacerbate or lead to high cholesterol, and I'll explain this. So, as your blood is rushing through your blood vessels, it actually is creating like shear force against these vessel walls. So, if you think about like a sand dune, right? And the waves are crashing against the beach and they're slowly eroding that sand away, right? As that blood is just whooshing and flying through your blood vessels because your blood pressure is high, that is causing little cracks and little damages into your blood vessel walls. Of course, your body is like, oh, dang, I have to fix this. So sometimes you get some fibers or like fibrinogen and protein that's there to kind of patch up that area. But sometimes that cholesterol and that plaque will stick into those grooves and into those scratches on the vessel wall. And then they harden, and then platelets come in, and you kind of get this snowball effect, right? So that's why it's equally important to manage your blood pressure along with your high cholesterol. I hope that made sense. Okay, so when thinking of cholesterol, of course, we are going to look at total cholesterol levels, LDL, or the low density lipoprotein. It's formerly considered bad cholesterol, and some people still consider it bad cholesterol. And then we also have HDL, or high density lipoprotein, which protects against heart disease, is considered the good cholesterol. So ideally, we want our total cholesterol levels to be less than 200 milligrams per deciliter. That's desirable. Between 200 and 239, then you're going to be borderline. Then we're going to start wanting to make some lifestyle, supplement, and nutrition changes to help bring that down. And then, of course, anything 240 and above is considered high, and you will likely be placed on statins to help correct the cholesterol. Now, with LDL cholesterol, less than 100 is ideal. And then their ranges are a bit more broken down than the cholesterol. But again, if these are elevated, this increases your risk of heart attack. It increases your risk of stroke. And we definitely want to keep it under control. Now, our good cholesterol, this is cholesterol that actually protects us against heart disease. And let me see if I have access to my notes, because I wanted to share a couple of factors and notes with you. So with HDL, we're actually thinking of the opposite. So with LDL and total cholesterol, we want it to be low, right? But with HDL, we actually want it to be high. We want our HDL to be at least above 40. If it is below 40, then that greatly increases your risk of heart disease, heart attack, and stroke. And that's because HDL actually helps kind of package up that fat in our blood and sends it to the liver so it can go into the bile and be excreted out in our poop. So if you have less HDL, then you have more fat kind of going around. So I like to explain HDL as kind of like our cholesterol's valet driver or Uber driver. Rather than it hanging around in our blood vessels, it takes it straight into the liver and the GI tract to be removed from the body. All right, so I wanted to take a moment to answer some common questions. So, oftentimes I'll have patients say, okay, well, what's the difference between the cholesterol in our bodies and dietary cholesterol? So, cholesterol in our bodies is naturally made in our bodies, and it's very important for making hormones. Many times, women who exercise a lot, they're kind of thin, they may struggle with getting pregnant, and they find that that's because they have low cholesterol. So, cholesterol is a starting point for our hormones. And so, it helps make our stress hormones, it helps makes our estrogen and progesterone and testosterone. But our body is so focused on survival, right? So if you have low testo or low cholesterol and you want to get pregnant, your body's like, "Hey, friend, I only have but so much cholesterol. You need to survive. So I'm going to shift this towards cortisol and keeping you alive. You can worry about having a baby when you have more cholesterol." So that's why we don't necessarily want no cholesterol. We just don't want too much. Now, dietary cholesterol can be found in some of the foods that we eat. So, generally, animal products, butter, milk, cheese, chicken, beef, and eggs. And I wanted to note that plant products like fruits, veggies, whole grains, and vegetable oils do not contain cholesterol. Cholesterol comes from animal products, and we make it ourselves. So, why is LDL cholesterol considered bad? Well, LDL or low density lipoprotein is often caused bad or called bad because too much of it, when it circulates in that blood, it can slowly build up and really start to create those plaques, right? Now, together with other substances like the platelets, like some of the fibrinogen proteins, they can form plaques and eventually clog your arteries. And when you have clogged, hardened arteries, that's called atherosclerosis. So, what we know is that when LDL's increased, that significantly increases our risk for developing heart disease, right? Now, LDL is considered the good one. Now, as I mentioned, LDL is kind of like the Uber driver for cholesterol, right? It carries it away from our arteries back into the liver to either be turned into hormones or be pooped out. Next, let's talk about cerebrovascular disease, aka stroke. So, this is the most common cause of neurologic disability in the Western world. And most strokes are secondary or caused by atherosclerosis, so clogged arteries, hypertension or high blood pressure, or in many cases, both. So, great question, Mary. She read that eating eggs was not an issue for cholesterol. Is that true? I think I take a balanced approach to this. I think that eating eggs versus other fatty fast food, please eat the eggs, of course. If you have high cholesterol, you could limit your eggs, but really we find that high cholesterol can often be exacerbated by sugar. And I think cholesterol has gotten a lot of bad rap in the past when really sugar is the villain in this story. It causes inflammation. It disrupts the way our body, uses and packages up cholesterol. So I would continue to eat your eggs. I would keep it balanced. I wouldn't eat too many or too often. Of course, diversify your breakfasts and your meals. But yeah, I would be concerned about other foods with regard to cholesterol than eggs. So, going back to cerebrovascular disease or strokes, there are some types. So, we have a cerebral insufficiency or TIA, that's a transient ischemic attack. You can see this over here. And it's called a transient ischemic attack because the blood can still flow through the main artery, but a clot has blocked a branch of an artery. So, you'll still get symptoms dizziness, in some cases, syncope or fainting, headaches, migraines are often associated with a TIA. But that's the difference between a TIA and an actual infarction. An infarction is when the primary blood vessel is blocked by the clot. Of course, this branch blood vessel is still open, but really, this primary one that's leading the blood directly to the brain is the one that is blocked off and thus causes the symptoms of a stroke. Now, a hemorrhagic stroke is when the blood vessels become thin and very delicate, and that high pressure. Remember, I talked about that blood pressure, it has the blood kind of flying through your vessels. Think of it as almost like a fire hydrant. It's really running through your blood vessels. And if your blood vessels aren't strong and intact, they can burst. And so that can cause hemorrhagic strokes. They're generally pretty much immediately fatal. And that's why it's very, very important to monitor your blood pressure, keep it as low as possible, and of course, making some dietary changes and lifestyle changes as well. All right, what's your perspective on plant-based diets, specifically vegan, and having an ability to have enough cholesterol? Another great question. I really feel like the ideal plant-based diet for most, and I'm going to put an asterisk, most people, is like an 80-20. You can still have 20% of, your meats and your eggs and animal products, but 80% of your diet should come from plants. So yes, it is possible that a vegan could have low cholesterol. And that's because, as I mentioned earlier, plants do not have cholesterol. So this is where you really want to support original, like the general production of cholesterol in your body. And sometimes that could be, taking a fish oil to help. And if you're vegan, it's hard to walk around that. If you're vegetarian, you can still eat butter, you can still eat eggs. But there are a couple of things that vegans can do to check their cholesterol. And I'm not honestly sure how often vegans come up with low cholesterol. I think overall, all of us, our body tends to know how to make cholesterol if we give it the building blocks. So um, having cholesterol in your diet can be good or bad, just depends on how much. It sounds like hemorrhagic stroke has two components, high blood pressure and weak blood vessel walls. That is accurate. Um, Let me see if I can see all of that. Um, is it because of high blood pressure or are there other reasons? Great question. So yes, high blood pressure can weaken the blood vessels because, after a while, it's going to get kind of lax while it's really dealing with this big flood of blood being pushed through, right? So, of course, there are some other things that can weaken blood vessels. In my experience, one of the reasons why, we tell people to eat fruits and eat the rainbow, of course, it's like, oh, yeah, there are benefits from each color, and that's all true. But darker colored berries and fruits and veggies have chemicals called anthocyanins or anthocyanidins. And these are the chemicals that give it its beautiful red, blue, and purple colors, right? But these act as antioxidants and really restore the integrity of our blood vessels. And so that's another reason to eat your fruits and veggies, to eat those dark leafy greens, because those micronutrients in that one little berry is going to help really strengthen those blood vessels, build that integrity, and try to keep it from growing weak over time, which it will. By the time you're 80, your heart's been pumping for 80 years. It might get a little lax, but there are ways to strengthen our blood vessels. And all of that cardiovascular disease is associated with another disease that we're all familiar with. I mean, I'm doing it right now. The sitting disease. Sitting is, what do they say? Sitting is the new smoking. When we sit, we're not moving our muscles a lot. We're kind of just hanging there. And by sitting, we're not really engaging our blood vessels, we're not engaging our body. And so let's take a look at this. On average, Americans sit 11 hours a day. So if you're sitting right now, feel free to stand up, get a stretch, march in place for a little while. Women are more likely to lead sedentary lifestyles than men. It's probably because we are burnt out from working and these kids, and everybody needs something from us. So rest when you feel like it, girls, because we deserve it. 65% of Americans watch 2 or more hours of TV every day. That tracks. And over 300,000 deaths occur annually due to inactivity and poor dietary habits. So, girl, these kids, honey, they'll work your nerve. So, please try to stand. I have an Apple Watch, and I try to set it to remind me, at least at the end of the hour, okay, girl, you have not taken 2 steps in the last hour. Let's get up and walk to the bathroom or something. There are a lot of different ways to increase our activity that don't necessarily require running a marathon, going to the gym, all of those things. Ooh, now we're going to take a break. If you have any questions, feel free to put them in the chat now. And it's just going to be a little quick break because then we're going to get into the good stuff. But I love this quote by Gandhi. It is health that is real wealth and not pieces of gold. I think that if the pandemic has not taught us anything, is that, yes, true wealth is having really good health, right? Whether it's from a quality of life standpoint, but also financially, especially with our healthcare model. Health is definitely real wealth. All right, let's keep going. Now let's talk about labs. Yay. So I wanted to offer this because when I would go over labs with patients, they would say, "Oh, my doctor never explained what that meant." And I was like, "Really? That's concerning." So I have taken it upon myself to educate the masses. So these are some lab tests that you want to keep track of with your doctor. And again, if you go to the doctor, you have my chart or whatever electronic portal, print out your lab work results. Take them to your doctor with you. Take them with you to your doctor. Highlight them. Ask questions. Might make notes because this is your medical information, and they should want to educate you and answer your questions. So, of course, the main blood test that we all get run is a complete blood count. This looks at the number and amount and size of your red blood cells and the number, amounts, and types of your white blood cells. And it also looks at platelets too. So it can identify anemia, it can identify low white blood cells, high white blood cells, either of which could be a sign of an infection or recent injury. And of course, monitoring platelets, because platelets cause clots, which can cause strokes and deep vein thrombosis or clots in your lungs and in your legs. So that's one of the labs you want to monitor. Know your baseline levels so then you can know where everything falls. Then a complete metabolic panel. Now, this is going to be looking at your kidneys and your liver. So this is, and often glucose as well. So this test is looking at the way your metabolic organs are functioning. Is your liver enzymes, are they high? And these markers are specifically for heart disease. Thank you, Shauna. I'm glad you're enjoying it. So it's going to look at your calcium, uric acid. If you've heard of gout, then you may be familiar with uric acid. The better your kidneys work, the more they can flush out the gout or the uric acid so you don't have gout in your joints. Your sodium, your potassium, and it also looks at creatinine, which is a protein that really helps monitor how well your kidneys are functioning or filtering. And then your glomerular filtration rate. Okay, this looks at how quickly your kidneys can process your toxins. And so with the GFR, this really tells you how healthy your kidneys are. Generally, it'll say it's fine if it's over 60. If it's less than 60, then we're concerned about compromised kidneys, right? This is important with high blood pressure because high blood pressure doesn't just affect your heart. It affects all of your blood vessels throughout your body, especially those blood vessels that go to your kidneys. And so the same way that fire hose is kind of flooding through the vessels in your brain, it's going in your kidneys as well. And it can cause damage to your kidneys, damage to that little glomeruli filters in your kidney. And then you're not able to filter out toxins as well as you normally would. You're also going to look at your fasting glucose and your A1C. Your fasting glucose will tell you how much sugar is in your blood just after 10 to 12 hours of fasting. How well is your body packaging up sugar for later use or just kind of letting it lie around? Your A1C is used typically for diabetics, but also just as a general screening. It measures how much sugar is in your blood over a 3-month time. So over 3 months, and they choose 3 months because our red blood cells live for about 120 days, and then they're renewed and reborn. So that really tells you how well you are managing your diabetes. And diabetes causes inflammation. It inflames our blood vessels, which further damages them and just causes more heart disease. Then, of course, we're going to do a lipid panel. So that lipid panel, we're going to look at your total cholesterol levels, your LDL, your HDL, non-HDL cholesterol, which is a little subset of another cholesterol particles, and your triglycerides as well. Can you discuss white blood cell count and the benign ethnic neutropenia? Is this a real thing? Wonderful question. So yes, your white blood cell counts, they are not only going to count the individual white blood cells, but also the percentages. So we have different types. We have neutrophils, we have lymphocytes. So neutrophils are really the big players that are going to be taking care of infections and those type of things. Your lymphocytes as well. Those are your white blood cells that kind of go around and monitor, make sure everyone is where they're supposed to be, everyone's who they're supposed to be. You also have eosinophils. These are often associated with allergies. So these will be elevated in folks often with asthma, with allergies, and if they're exposed to anything that's causing an allergic reaction or a release of histamines. Then you're also going to look at basophils that can be associated with allergy, sometimes can be associated with like parasitic infections and other infections like that. So benign ethnic neutropenia. I'm not an expert on this. I have had a client or a patient who came in with seemingly benign neutropenia. I ended up referring her out, so I haven't been able to really get an update on how she's doing. But there are a couple of things that can be done to raise your neutrophils and your white blood cells. But that's why it's also important to know your baseline, so you can know whether are my neutrophils just normally low and that's how my blood is? Or am I fighting something? Is something happening with my blood? All right. Another great question. Does your adrenal gland have a role in hypertension and or kidney function? Yes, it does. I'm so glad you asked. So our adrenal glands are little organs that sit on top of our kidneys and our back. And they make tons of hormones. They make our cortisol, which is our stress hormone. They make adrenocorticotropin hormone, which releases and manages our salt balance. And that is one of the hormones that impacts blood pressure. And so it's interesting because sometimes folks can have an adrenal tumor called pheochromocytoma. I don't know. I'm tearing up that word. But there's a there is a tumor on your adrenal glands that release that hormone that falsely increases your high blood pressure. So that's one of the things your doctor will rule out to make sure that either you genuinely have high blood pressure or you have another thing that's causing your blood pressure to be high. Sometimes those hormones can have an impact on our kidneys, particularly how well they filter, the speed in which they filter. And so having our adrenal glands measured, yes, thank you, Yolanda. It was getting caught up in my mouth. So yes, the adrenal gland does play a role in balancing high blood pressure and prioritizing kidney function. All right. So other testing, you will also do a urine analysis. Every time you go to the doc, they ask for a little bit of pee. And it's not just for a UTI, they're also looking at how well your kidneys are functioning. Signs of kidney damage associated with high blood pressure is having excess protein in your kidneys. And that's because really your protein shouldn't be seeping out into your urine like that. It should be kind of bound up and prepared for excretion and elimination elsewhere. So a sign of a lot of protein in your urine is a sign of a compromised kidney. And to look at that protein, they'll be looking at urinary albumin. Thyroid, we're also going to be looking at your thyroid because hyperthyroidism can cause elevated blood pressure. So we want, again, to make sure that you have, whether or not you have high blood pressure, that's called essential high blood pressure, that's generally associated with diet and lifestyle, or if you have high blood pressure due to adrenal dysfunction or thyroid disease. Your doctor should also monitor inflammation markers. So HSCRP, or highly sensitive C-reactive protein, is a marker that identifies inflammation. If this marker is elevated, that means that you have quite a bit of inflammatory molecules in your body and really need to prioritize antioxidants and reducing inflammation. Homocysteine also looks at, it's a protein that really helps identify your risk of developing cardiovascular disease and can be involved in B12, cobalamin, and B9 deficiencies. ApoA1 and ApoB, these are proteins that are carriers for our lipids. And so the presence of these and certain amounts can indicate that you are at increased risk of developing heart disease. Of course, we want to look at vitamin levels, particularly vitamin D, because vitamin D is not just a vitamin, it is a hormone. And it plays a role in many, many, many different processes and biochemical pathways in our body. Our cells, nearly every cell in our body has a vitamin D receptor. So if you have low vitamin D, it's not just, oh, you're not getting enough sunshine. It impacts nearly every cell in your body. And as Black people, as African Americans, we are highly melanated, right? Yes, we are. While that is wonderful and it is amazing, it does impact our ability to naturally make vitamin D because the melanin in our skin readily absorbs UV light from the sun. But that UV light is what's needed to help make vitamin D in our skin. So that means, in my personal opinion, this isn't medical advice, but in my personal opinion, every Black person should be taking vitamin D. Of course, check your vitamin D levels. You should check them at least every 6 months, ideally every 3 months. And you want scores between about my ideal is 60 to like 75. And I will be vulnerable here. I will share that when I went to my last doctor appointment, and it's so crazy I'm admitting this, but my vitamin D level was so low that I was like, you should probably run this again. This is kind of ridiculous. But it explained why I was feeling so run down and so just worn out. So get your vitamin D levels checked. Take a vitamin D, please, and thank you. And then there are also genetics, so genes. Many people have heard of a genetic SNP or a genetic edit called MTHFR. This affects how well your body methylates these vitamins. So, how can I explain this? When you methylate a vitamin, particularly B vitamins, it makes it a lot easier for your body to readily use these B vitamins. But if your body isn't doing a good job of methylating them, then you're not really getting as much of these B vitamins as you need, and you're kind of always going to be circling the drain in terms of being deficient in these. So it's always great to run these, especially if you think you may have an issue with B vitamins. And then the ApoE genotype is another genetic test to see how much you're predisposed to heart disease based on your genetics. All right, great question. Are we getting these labs during one doctor's visit, and how frequently are getting the labs completed? Once a year or more frequently? Great question. Thank you, Sarah. Essentially, depending on your age, if you're going in for your annual checkup, your annual physical, your doctor should be running a CBC, a CMP, a lipid panel, definitely for your annual physical. You'll get a urine analysis, they'll check your thyroid. And depending on if you already have like high blood pressure or diabetes, they may run the CRP in some of these as well. Generally, most docs will run vitamin D. And then the genetic tests, in my experience, most MDs will not check for it. Generally, you'll have to find a functional medicine doctor to identify that. So either a functional medicine doctor or a naturopathic doctor. And then depending on how often they're repeated depends on your results. So if you have high blood pressure, it's poorly controlled, you're likely going to see your doctor every month, every 2 months, maybe every 3 months, and your labs may be repeated at those visits. But if you're stable and doing well, then, it could just be yearly. And yes, the vitamin D labs, ideally every 3 months, at least every 6 months, especially if you're taking a vitamin D supplement that's a bit on the higher dosage, so 5,000 IUs and above. And then we have another question. Does low vitamin D levels have an effect on pregnancy in Black people? I have to look in the research to confirm, but from what I've seen, yes. Vitamin D, I have found, really is very important just for overall health, longevity, vitality, vibrancy. I don't think it's any mistake that nearly every cell in our body has a vitamin D receptor. I think that alone highlights how important vitamin D is, and especially in pregnancy because we're cooking a whole human. So your body is like, girl, now I barely have enough vitamin D for us, and now I have to share with this baby. One of us is not going to have any, and that's definitely going to be you, mama, which is oftentimes when women will have like, you know, I've heard stories of women, their teeth fall out because they're already depleted in their nutrients. And so the baby's pulling calcium from your bones, pulling calcium from your teeth. And so, really, it's very, very important to be, of course, taking your prenatal vitamin. I tell women that vitamin is for you, it is not for your baby because your baby's going to get what he or she gets, okay? This is for you so you don't fall apart in the meantime. So it's very, very important to make sure that you have healthy stores before you get pregnant and at least starting your prenatal, ideally before you get pregnant, but definitely as soon as you find out. All right. The inflammation or genetic panels, yeah, definitely not common with the PCP. Generally have to find a functional medicine doctor or a naturopathic doctor. And then I found that it's important to specifically request a full lab panel and specifically ask for A1C. Yes. If you are pre-diabetic, your doctor is likely going to run an A1C just to make sure you're not trending towards diabetes. But if you normally have healthy blood sugar and you want to make sure that everything is going good, you may have to specifically ask for an A1C. But it is so quick, it's done in office. You should get your results the same day. All right. Foods for a healthy heart. So I've broken this down into dietary goals and then foods to focus on. And my formatting is just, sorry y'all, it's driving me crazy. So, dietary goals. Here's some goals that we want to keep in mind when we're trying to adjust our diet for heart health, right? So, we want to normalize a potassium and sodium ratio. So, that means either really that's looking at diet. Some people may say, oh, you can look at your labs, but our electrolyte labs, our blood in our body keeps a very tight check on those electrolytes. So looking at your blood levels of sodium and potassium is okay, but really you want to look at your diet to see how much you're intaking, or at least take a multivitamin with plenty of potassium in it. You want to normalize your blood sugar and your insulin. If you have a family history of diabetes, you need to be taking you're measuring your A1C for sure at your doctor's office, and also have them measure your insulin as well. In case many of you don't know, insulin is kind of the key that unlocks the cell to let blood sugar in. I think of our cells as a house and our blood vessels as the neighborhood street, right? So think about your home and the street your home is on. The UPS truck is our food, and it comes and brings us our sugar, right? Because after we break down our foods, our body naturally turns it into sugar, some of it, the carbs. And it brings those packages and it rings the doorbell. The doorbell is insulin. Insulin lets the cell know, hey, we have some sugar, let it in. But over time, if we're constantly eating sugary foods and bad foods and processed foods, UPS is always at our door, ding dong, ding dong, ding dong. And eventually the doorbell is like, well, they've been ringing the door all day. She still hasn't opened the door. So we're just going to leave it on the porch. And so diabetes happens when that doorbell stops working and all those packages of sugar, they don't just stay on your porch, they're in your yard and then they're in the street, blocking traffic. And so that's really what happens when we develop diabetes. And that's why it's important to normalize that for our heart. We want to increase fiber. We don't eat enough fiber. I don't even eat enough fiber, but it's so important, not just for our gut, because it helps absorb toxins in the bile. It helps pass our stools so we can get all of those toxins and extra hormones and stuff out of our body, right? But it also can help bind up fats and help us better adjust our fat metabolism. So fiber is very important. We want to decrease sugar because increased sugar means increased inflammation, which means sticky vessel walls, plaque, atherosclerosis, and on and on and on. Lower caffeine because caffeine can raise your blood pressure, and you want to decrease alcohol because it is inflammatory and just is going to cause even more problems. Now, foods to focus on. These are foods you want to incorporate into your diet. So, celery. I know last year, sometime during the pandemic, celery juice was all the rage, right? Well, it acts as a diuretic, so it's going to help filter out the salt in your diet. It's going to help your kidneys. So, adding celery to your diet is great. Try not to overdo it. Garlic and onions, they don't just taste good, they're great for our heart. I'll tell you more about that in the herb section. Nuts and seeds, they have essential fatty acids, omega-3 fatty acids that are anti-inflammatory, antioxidant, just overall wonderful for our health. Cold water fish, like salmon and mackerel, also have essential fatty acids like omega-3s, very important for inflammation. Our green leafy vegetables, not only do they have those dark pigments that help with the integrity of our blood vessels, but they also have minerals like calcium and magnesium, both of which play a very big role in heart disease and hypertension specifically. Then we have whole grains and legumes. That's how we get our fiber. Citrus fruits for our vitamin C. And of course, berries, cherries, grapes, kidney beans for those darker pigments to help with inflammation and oxidation. I also wanted to talk about two diets that you may have heard of. The DASH diet, which was created in part by the National Heart, Lung, and Blood Institute, and it stands for Dietary Approaches to Stop Hypertension. The goal is to lower and prevent high blood pressure. You're going to be doing this by reducing your salt intake and incorporating more nutrients, so more potassium, calcium, magnesium, and fiber. So you're going to be including fruits, veggies, whole grains, lean meats, lean fish, eggs, beans, low fat or fat-free dairy, nuts and seeds, and healthy oils. Now, this could be a whole topic and talk on its own, but healthy oils. Healthy oils are unsaturated oils. So my list of healthy oils are avocado oil, especially if you're using high heat, olive oil, and coconut oil. You might find some that like grapeseed oil as well. That's good. But the vegetable oils, canola oils, all of those, not good. They're inflammatory, very bad for our heart health. We do want to avoid those. So we're going to avoid, for this diet, full fat dairy, breaded and fried foods, high sodium foods, processed foods, all of those things. This is one option that your doctor may bring up to you, and I wanted to just introduce it. But really, my favorite diet for heart health is the Mediterranean diet. It is the most studied diet. There are countless research studies on the benefits of the Mediterranean diet, and it's kind of really easy to follow, honestly. It's very no nonsense. You really just want to eat high quality veggies and fruits, whole grains. They really have an emphasis on olive oil because it is healthy for us. Wild fish, high quality meats, and dairy and nuts are great as well. And really, we're just avoiding processed and refined foods. So when I tell folks about the Mediterranean diet, really the majority of your shopping is going to be on the periphery of the grocery store, right? Because that's when you're getting your produce, your grains, Sometimes you'll get your grains in the aisles, and then your meats in the back. So you want to limit how much time you spend in those aisles in the middle, because that's where the processed junk foods are, and spend most of your time in the periphery. All right, nutrients for a healthy heart. I broke these down into vitamins, minerals, and other micronutrients. So we want to be making sure we're having enough vitamin C, B vitamins, and vitamin D. We want to make sure we're taking a multi-mineral on top of a multivitamin that has calcium, magnesium, and zinc. Then also there are some other micronutrients like essential fatty acids, fish oil. If you're vegan or vegetarian, you can do flaxseed oil or algae oil. Polyphenols. These are the compounds in fruits and veggies that are anti-inflammatory and antioxidant. NAC, N-acetylcysteine. This is an amino acid that is one of the building blocks to make our gold star antioxidant glutathione. Remember glutathione. So we want to take NAC to help our liver really metabolize all of our products. I did a really phenomenal detox webinar for work. I'll see if they'll let me share it with you guys, or I might tweak some things to share it with you guys. I think it's phenomenal. CoQ10, which is another nutrient for our mitochondria. Now, if you don't remember anything else from school, what do we remember? The mitochondria is the powerhouse of the cell. Yes, right? That's like the one thing we remember from biology in school. Well, that's true. And our mitochondria need CoQ10 to function well and really help us make energy for our cells. So CoQ10 is important, and we'll see why in the next slide. And probiotics. Probiotics have a very big role in heart health and really overall health. I'm going to save that for another day because I could talk about the gut all day long. But definitely, you need to take a probiotic. All right, questions. We have, is there an olive oil you would suggest? I definitely like organic. And honestly, I haven't been too picky with brands. You just want to make sure that it is extra virgin and that it's organic and cold pressed. Because if they're adding heat, it can make the oils rancid and cause more inflammation and more problems than helping. What about paleo? Paleo would be good for heart disease. My only qualm with paleo is I feel like it doesn't allow for enough whole grains, and that's really where we get our fiber from. So if you can make some adjustments to kind of increase that fiber when you're on paleo, I would support that. Examples of multi-minerals. Great question. My favorite multi-mineral is a liquid called trace minerals. And if you go to my website, there's a tab called Holistic Pharmacy. You click that, you can make an account, and then I have a catalog of professional grade supplements that you can order. And so this is called Trace Minerals. I'm going to put that in the chat for you. Trace Minerals Liquid. Literally 10 drops in a bottle of water is all you need. It gives you all of the minerals that you may need. And it's quite a few. So I think the dosage is anywhere from 10 to 40. I always have folks start at least with like 5 or 10 and just slowly work your way up, because it is going to have an impact on your health, because these are molecules that are very active in our body. Okay. Now, I mentioned these nutrients because they are often depleted by common heart medications. Specifically, these are nutrients that are depleted or worn down by statins. So statins are medications that you take for high blood pressure. Most people are familiar with the brand Lipitor. atorvastatin, lovastatin, all of those. So, really quick question, side effects or negative impacts with other meds, with the multiminerals? Great question. You always want to check for interactions. Generally, I haven't seen many interactions with trace minerals and medications. However, if you have thyroid disease, I would do low dose because the minerals do have a little bit of iodine, and we know that iodine, the balance of iodine is very important with thyroid. If you have mental health conditions, some of these trace minerals may have a little teeny tiny bit of lithium. And so some people find benefits from it. Others find that it may exacerbate or aggravate some mental health conditions. So that's why I always follow the dosing instructions and definitely check for any interactions. Now, when you take a statin, it is impacting how much fat we absorb, right? Now, in the process of blocking this enzyme and pathway, statins also block the absorption and utilization of different vitamins. So, CoQ10 that I mentioned earlier, that's good for our mitochondria. Vitamin K2 is often blocked by statins. Now, vitamin K2 is very different from K1. So, K1 is the one that's used and involved in blood clotting, and it's called anticoagulation. It's preventing the development of clots. Now, K2 has not been shown to have coagulation activity. So it's not going to change how quickly your blood clots in most patients. Now, vitamin K2 actually can activate proteins that pull calcium from our diet, even from our vasculature and our arteries, and deposits it directly into our bone and our teeth. So this is perfect for postmenopausal women who may be worried about osteoporosis, definitely for young women in 20s and 30s while we're trying to build our bone, and just very important overall. I consider vitamin D and K2 to be calcium's valet drivers. I like to call them the valet. So it takes calcium directly where it needs to be. Statins can also deplete omega-3 fatty acids, fat-soluble vitamins like vitamin A and E, a mineral called selenium, carnitine, which is an amino acid, and copper, zinc, and creatine. All right, last few slides and then we are done. I'll let you enjoy your Saturday afternoon. Herbs for heart health. If you know me, you know that I'm an herb girl. Okay, I will reach into my little pack of herbs and mix up something with the quickness. I know my parents and my friends and my husband are sick of me, but I'm not mad about it. So let's talk about 6 herbs for a healthy heart. Number 1, we're going to talk about linden or Tilia europaea. It is ideal for a mild hypertension. It mildly lowers your blood pressure. And its action is it's a diuretic and it's an antispasmodic. So it helps relax those blood vessels, which helps them dilate. And then that blood vessel gets wider. So all of that blood has a little bit more space to flow in. And so your blood pressure lowers that way. And it will reduce blood pressure when it's associated with arterial sclerosis or hardening of your arteries, or nervous tension, because sometimes when we're nervous or anxious, it does increase our blood pressure. Then a personal favorite of mine, hawthorn or crataegus. It's mildly hypotensive, so it's going to help reduce blood pressure, but it also reduces the heart's oxygen demand. So the heart doesn't need as much oxygen to get the work done, and it helps the heart pump more efficiently. Now, it can take 2 to 4 weeks for it to work. So you do want to be consistent and give it time to work. And there aren't any known contraindications or cautions associated with it. Then ginkgo biloba. Ginkgo helps increase blood flow. It's an antioxidant. It does have some anticoagulant effects, and can be anti-atherosclerotic. And that means that it helps prevent the plaque depositing into your arteries and the hardening of your arteries. And it also decreases platelet aggregation. So it decreases how many platelets can clump together and make a clot. And it's really great at preventing strokes due to clots. There are some contraindications with ginkgo, though. So you do want to use caution if you are on anticoagulants like warfarin, Eliquis, Pradaxa, some of those. And especially aspirin as well. If you also don't want to take it within 14 days before surgery because you'll be having surgery. You want to limit how much you'll bleed. And then also avoid if you're on anti-seizure medications or on tricyclic antidepressants, and especially if you have a history of bleeding or having seizures. Next, we have good old Allium sativum, or garlic, and Allium cepa, or onion. So, cooking with garlic and onion, of course, it helps our food taste amazing, but it's really great for our heart. These two herbs are cardioprotective, and they have antiplatelet activity. So, they reduce how quickly the platelets will form clots. Now, there are some contraindications or reasons why you shouldn't use it. You don't want to use it within 10 days of surgery or with medications that may prevent your blood from making clots. You want to avoid excessive use in pregnancy because it has the potential of causing bleeding. And so it could cause a miscarriage or loss of the pregnancy. And you want to avoid excessive use in hypothyroidism, or often called Hashimoto's disease if it's an autoimmune thyroid condition. And that's because it can affect the way that iodine is used in the thyroid. And then some people can have allergies to garlic and onion, so be very mindful of that. Last, we have another favorite, motherwort, or Leonurus cardiaca. It is extremely beneficial for both the cardiovascular system and for women's health. As a heart tonic, it is used to help strengthen the heart, helped with palpitations, high blood pressure, and can relieve the pain of mild angina. And angina is that chest pain that you may feel that may not necessarily be associated with a heart attack. And then lastly, we have hibiscus. Hibiscus makes a delicious tea. It is one that has a lot of those same anthocyanins or anthocyanidins that make it red, gives it that really beautiful red color. And it's very effective at lowering both the systolic blood pressure, or the top number, and the diastolic blood pressure, or the bottom number. And as of today, there aren't any known contraindications or cautions. So that is it. Thank you so much for spending the last hour and a half with me. We covered so much material. If you have any last minute questions, please feel free to put them in the chat. If you want to stay in touch with me, I will be putting up more videos on this YouTube channel at Dr. Sarah Ellis. I haven't been very active on social, so you're not likely to find me there. I'm going to try and get into TikTok. We'll see how that goes. You can always email me at drsarah@ellisfamilywellness.com. And of course, visit my website, ellisfamilywellness.com. Again, the place to get the slides, these same slides, I will email them to you if you signed up at Eventbrite. And then if you're watching on YouTube, I will have a link in the description box where you can sign up and get the slides and other resources. And I also have a podcast. I'm actually going to put this audio on the podcast. So, hey, y'all, if you're listening, my podcast is called The Black Girl's Guide to Natural Medicine, and it can be found wherever you get your podcasts. All right. Hi, Therese. Thank you for this question. What's considered excessive use of allium cepa and sativum? More than 10 cloves of garlic a day and more than 1 onion a day. I would say definitely more than 10 cloves of garlic. Anything more than 10 is going along the excessive side. And probably maybe 2 onions a day. But yeah, that's what I would consider excessive. And of course, we can eat them, but there's also really interesting tinctures and glycerites or herbal preparations of onion and garlic that actually don't taste half bad. So thank you so much for joining me. If you end up watching this on YouTube later on, continue to post questions. I'll try and hop in and answer any questions. And I will see you all next month. I think next month we're going to dive into a little bit of gut health. So send me your questions for gut health. It's going to be a broad overview like this one, but it'll be fun. Is it okay to take the liquid minerals and the 6 herbs daily with other multivitamins? Great question. Let me go back. I encourage folks to at least consult with a functional medicine doc or a naturopathic doc, and really a naturopathic doc. Functional medicine doctors don't have the same training as naturopathic doctors. I would really want you to consider consulting with them first before incorporating. I would not do all 6 of these herbs. I honestly I would pick one, and really the mildest one. So Crataegus, hawthorn is pretty mild. I wouldn't, if you're new to using herbs, I wouldn't go directly for ginkgo. Motherwort is also pretty gentle. And of course, hibiscus is gentle as well. So you could also start with just doing some hibiscus tea. There's a brand called Traditional Medicinals, and they make my favorite tea blends. And I would start with just maybe 1 or 2 cups of hibiscus tea with a little lemon and honey in the mornings, and try that. And then the liquid vitamins, yes, you can take the liquid mineral with other multivitamins. You can take hibiscus and motherwort and crataegus with other multivitamins as well. Yeah. You will get an email for the next class, and I'm actually going to have, hopefully, a resource library so you all can go in and see recordings and slides and meal plans and all that cool, fun stuff I have for you. So thank you so much for joining me. Thank you, everyone. I look forward to seeing you next time. And share this video if you loved it. Share it with friends or family that you think would love it. Have a great rest of your weekend, and I'll see you guys next time. Bye-bye.